Hey everyone, Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it just doesn't make sense to have anything but the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. In today's episode, I had the opportunity to interview an esteemed colleague and friend, Dr. Garek Ng. In this episode, we're talking about more advanced natural medicine, something called ozone therapy. This regenerative therapy has been found to be extremely helpful with people dealing with arthritis, with adjunctive cancer care, and overall strengthening your immune system, meaning that it can be extremely helpful for a lot of different conditions. Dr. Ng does show us a graphic where you can see before and after effects of ozone therapy, so make sure to check out the video version of this episode on YouTube as well. Some more about Dr. Ng. Dr. Garek Ng is a licensed naturopathic doctor and the founder of Biomed Health Center located in La Jolla, California. He is a graduate of Michigan State University, so being a Buckeye myself, naturally we've had a lot of friendly rivalry. He is also a graduate of Bastyr University in California of naturopathic medicine. His practice emphasizes biochemistry and physiology to address optimal human function with focuses including endocrinology, gut health, immune disorders, and pain management. In this episode, we get into the ins and outs of ozone therapy, and Dr. Ng has provided a lot of great resources, so make sure to check out the show notes if you are interested in learning more. Also, make sure to leave comments below on what you thought of this episode and reach out to Dr. Ng or myself after the show. All right, enjoy. Hello, Dr. Ng. How are you doing today?
Hi there, Dr. Patel. I'm doing great. Thank you so much for having me.
Of course. Thank you so much for joining me on my show today. Really, really appreciate having you here. So we already gave a little intro about what you do, and so we're going to get right into it. I ask all of my guests this question because I think it's really important to know what our story is. Our stories are what really define us. And so I want to know what your story is. What is your journey? What brought you to naturopathic medicine?
Yeah, absolutely. I'm very fortunate in the fact that I have a professional mentor, being my father. And so you've met him.
Yes.
Dr. Ng Sr. He's a great guy.
Yeah.
But basically he's a traditionally trained medical doctor who kind of found his own path towards holistic medicine and eventually dove into that full-time in private practice. And so that was kind of a environment that I grew up with. It's kind of something that's been ingrained in me since I was very little. So I guess it was very easy for me to kind of get into naturopathic medicine because it's always been a part of me.
Yeah, a part of your life. I mean, you grew up with the lifestyle pretty much.
Yeah, some things maybe I would take for granted, just like the meals that we would eat, just being healthy. A lot of things were different about my upbringing in a great way.
Yeah, that's amazing. All right, so what got you more interested in ozone therapy specifically then?
Yeah, ozone therapy is something that I guess I've become more familiar with the past 5 years. There's been a lot of really amazing doctors using it more frequently and just diving into the research, diving into the clinical cases, seeing the results. It's pretty incredible, the power of ozone, and I feel like we should be using it way more.
Yeah, so getting right into that, what exactly is ozone therapy? I know I actually was never introduced to it until you had brought it up and you had exposed me to it, and then I ended up doing a little bit more of my own research, but you're the first person I learned about ozone from. So what is ozone therapy?
Okay, so ozone therapy, it's the administration of ozone gas into the body, and then the results are incredible healing benefits. Ozone is O3, so it's 3 oxygen atoms instead of 2. O2 is the oxygen that we breathe. O3 is ozone. And usually that actually happens via some sort of energetic kind of agitation that splits up an oxygen and O2 molecule and makes them bump into each other and create these O3s. The administration, yeah, it's funny that you say that you'd never heard about ozone because it's been around for hundreds of years. They've been practicing it successfully for at least 100 years, especially in Europe. They've done it a lot. Mm-hmm. Over here, I think there may be other factors as to why it's not as popular, but hopefully we'll spread the word here.
Yeah, and that's what we're trying to do, right? Spread the word on all the different types of healing methods and not just what's conventionally out there. So mm-hmm. That's it. So could you explain a little bit more about how the O3 specifically can be more beneficial for us? Like you said, we normally breathe the O2. And so what about the O3 can actually be beneficial? Like, how does that work?
Yeah, to kind of keep it simple, I'll put it into 3 main categories that ozone really helps out the body. The first one is it modulates the immune system. So in a lot of the people that we're seeing being chronically ill or having these chronic pain issues, that what that boils down to is calming down inflammation. And that's probably the most profound benefit that ozone can do. It calms down inflammation, decreasing pain, and decreasing systemic issues all over the body. Also, what it does is it makes oxygen more available. It shifts the oxygen dissociation curve to the right. If you remember what that means, yes. This makes oxygen more available to the tissues, in addition to providing oxygen itself being a molecule composed of 3 oxygen atoms. It actually allows the tissues to get more oxygen. We all need oxygen to survive, and our cells need oxygen to create energy, and creating energy is probably one of the most basic steps to help people that we do here. Really profound effects. And then also it's been shown to promote stem cells with all the research around stem cells. You can look up all the benefits of that. But when it comes to healing, that's a huge component too. Oh, also it's antimicrobial, so it kills bad stuff.
It kills bad stuff. The bad bacteria that helping with infections and things like that. And I think that also plays a factor in the immune modulation part of it that you talked about initially, the first thing that you talked about and its benefits. And I think it's important to, for what you said, for our chronically ill patients, a lot of these people have autoimmune conditions, and
absolutely
anything that's stimulating the immune system can actually still be harmful. And so it's nice to have something that can modulate it or keep it in balance. So something like ozone can be very beneficial in that sense. Right.
Yeah, absolutely. Yeah, you need things that modulate the immune system rather than just shutting them down or really turning them up.
Yeah.
The immune response is incredibly complicated, as you know, and many factors signaling each other. It can swing either way. So it's kind of like a teeter-totter.
Yeah.
So, oxygen and ozone definitely help modulate that system.
Yeah. And I would say there's a lot of conventional medicines for autoimmune conditions are about shutting down the immune system. So I like how you said we don't want to take it to either extreme, right? You don't want to shut it down or really stimulate it, which sometimes a lot of natural therapies can do is really stimulate the immune system. And so keeping that in balance and one of the best ways to do that is by using ozone.
Absolutely. Yeah, you said it. Keep it balanced.
Yes, exactly. So what are the different modes of transmission? I feel like I keep hearing more and more the more I learn about it. So
yeah.
And what do you normally do in your practice?
Yeah, so the most effective way to get ozone integrated systemically is to push it IV into your bloodstream. And that's something called MAH, a major autohemotherapy. Essentially, this procedure involves drawing your blood out, mixing it with ozone, and then pushing it back through into your system. And that just gets it directly into the bloodstream. As you know, getting things directly into the bloodstream always, it's just more available that way. There are other ways to do it. You can actually infuse ozone into water and drink it, and that will get into your system, GI system. There's something called insufflation, for those of you not familiar with that. That's actually just pushing gas rectally. And so that's a way to
I'm sorry, could you repeat that? I think
that's that's pushing the gas into your system rectally. So with a catheter tube and a bag of ozone. And so that's another way that you can get it into your system pretty effectively. And also, if you want to be more targeted towards GI conditions, that's pretty cool. And then also Prolozone is amazing. IM injections, soft tissue injections, also in joints. Really super helpful in pain, sports injuries, osteoarthritis, stuff like that.
Could you explain that one a little bit more? How does that work? I mean, how does that compare to prolotherapy itself?
Yeah, absolutely. So prolotherapy is this concept of actually inducing inflammation. You're injecting a solution of dextrose and maybe some anesthetic into the tissues to kind of agitate and create inflammation, which in theory and in actuality does recruit inflammatory molecules to the area in hopes of healing it. Ozone works a little bit differently. Like we said, it modulates the immune system, so it tries to calm down that inflammation. Also, one thing to consider with the joints themselves is that anytime you're dealing with cartilage specifically, the blood supply is really, really poor. So any sort of healing process is really dampened because of the lack of ability to get healing factors and specifically oxygen to those areas. So what we're doing by injecting ozone is we're actually delivering a vital source of energy production right into the tissues that kind of lack it naturally.
Yeah, that's great. That sounds amazing. I feel like that needs to be used for so many people and so many more offices. We definitely need to bring this to the state.
Absolutely. And then when you're considering more conventional treatments like steroids, which pretty much just shut down inflammation. They shut down the symptoms. They make your blood real sugary. I don't know. It's very silly and ludicrous almost to do to think that you would do like a cortisone injection versus ozone when you think about the biochemistry behind it, and you also think about the cost. Ozone is fairly cost effective. So.
Definitely. I mean, in the long run too, the negative effects of the steroids, like you said, I mean, it's simply masking a symptom. And so that cartilage that you said that is diminished, like it's not actually helping that. And with the ozone getting that direct oxygen supply, you're actually able to work your body's own healing process.
Yeah. So I love ozone. We have seen some really cool results when it comes to osteoarthritis cases. I actually have a picture. I don't know if this is going to work, but maybe I'm going to try and hold it up here.
Let's try it.
Can you guys see this at home?
Yeah.
All right.
I can see it.
Okay, I'm all turned around here. So this right here, what we want to look for is the space in between, I guess, fluorescent bone here, right? So if there's a lack of space, that means that that's bone on bone. There's no cartilage.
Right.
This is before this lady was about 80 years old, recommended to get a knee replacement because of this image. And then she underwent 3 ozone treatments. And you can see the space open up. And what that means, she just regrew all her cartilage there.
Wow.
After 3, she avoided a knee replacement.
That's amazing. Yeah, for those of you listening, I highly recommend getting onto the YouTube channel and checking these images out because it's absolutely amazing. But he did a great job explaining how you could see that the bones are actually, there's no space between the bones in the knees. And so the cartilage is completely gone. And then within just 3 treatments, you saw that improvement?
Yeah, that's just 3.
Wow, that's amazing.
Yeah, so the ozonides that are created from injecting ozone
Mm-hmm.
are a big part of kind of signaling this whole inflammatory or calming the inflammatory response.
Mm-hmm.
Those can linger around in the body for 2 to 3 months, so it can be pretty lasting.
Wow. And yeah, how often do you normally recommend treatments for, I guess it depends on the situation, but like for this this patient, for example, how far apart were her treatments?
Yeah, so generally we recommend to do 6 treatments right off the bat in a week succession. So 6 weeks, 6 treatments.
Okay.
But as you can see, some people get results after only 3. So
yeah, that's great. So what else can we use? So we talked about osteoarthritis and some autoimmune conditions. What else can we use ozone for? And then we talked about bacterial infection. So, what else is out there? I know some people use it for sports enhancement. So if you want to talk a little bit about that too.
Yeah, so the thing about ozone and the thing about a lot of the therapies that we really push here is that it comes down, we're getting down to root causes and basic biochemistry that spans, the whole body system. So really we're talking about ozone just building you up from the root level, delivering oxygen to these tissues, and we're getting energy production from that. So realistically, ozone will help you with almost any condition you can think of. For sports, for people who are athletic, definitely you see increases in energy, and a big part of training that people like about ozone is that it cuts down on that inflammation, so the recovery time is quicker. There's strengthening, it increases the ability to create strength, and so you see things like fatigue, the stamina go up, fatigue go down, and strength increase as well.
Yeah, that's great. So, okay, so we talked about a lot of great things that ozone can do. What are some potential side effects? Like what could go wrong with ozone? Or are there any side effects?
Ozone is really, really safe by almost every single application. You don't want to breathe it in. Actually, it's pretty toxic to the lungs. So you may hear of ozone being a pollutant, and it's only a pollutant if it's inhaled. So that's one thing you want to watch out for. No one is doing breathing ozone therapy, so don't even worry about that.
And that makes a lot of sense because we need to breathe in oxygen, so bringing in that third oxygen molecule probably isn't best for us.
Yeah, don't breathe it in. It's a bad time. Other than that, side effects are really minimal. Sometimes maybe you might get like a minor Herx reaction, which, as we know, is kind of a sign that you're killing off an infection, and you're kind of getting a response to a large die-off. So that actually is a sign that you're healing. And then if you're not really, it is an oxidant. So if we're getting deeper into it, you need to make sure that you have a proper balance of antioxidants to oxidants in your body. So you need to consider that when you're doing the ozone as well.
Okay. Yeah. Good to know. And then because I've heard of people using ozone therapy for cancer specifically. And what are your thoughts on that? I know we talked about the modulation of the immune system and how it can be helpful, and then even the concept of it being an oxidant, so it can help kill off a lot of these cancer cells. But what are your thoughts around using ozone therapy for cancer in general?
Yeah, ozone actually can be really helpful in cancer. A lot of these cancer cases with the therapies that are maybe more prevalent in naturopathic medicine, we're trying to look at this kind of thing called the terrain, like the environment, right?
Yeah.
And so your healthy cells thrive in a certain terrain, and cancer cells thrive in a certain terrain. Cancer cells live off of sugar fermentation, glycolysis. This means they're anaerobic. And so by changing the terrain, shifting it to a more oxygenated environment, that alone has been shown to do really effective things with cancer treatment. Yeah, and so when you use it in combination with some of the other things, vitamin C, glutathione, it's really powerful stuff.
Great. Awesome. So do you have anything else that you'd like to add that maybe I didn't get to ask you about ozone therapy?
I'd say you want to make ozone therapy, is something that everyone should check out more. And maybe if there's any sort of stigma about it, just read more into the foreign research. There's a lot of research out there coming from Cuba specifically, maybe from Spain. You might find some really good research. You have to go to those places to find it, just because their healthcare systems might encourage that kind of discovery a little bit better. So I don't know. I encourage people just to reach out maybe to you or I and find out more information about it.
Yeah, definitely. And we'll have all of Dr. Ng's information in the show notes. So if anyone has any more questions about ozone therapy, they can always reach out to you. Like I said, we'll have all your information there. Or myself. Yeah. I feel fairly comfortable talking about it, but you're definitely the guru, I would say, when it comes to ozone therapy.
Yeah. 3 things: ozone, vitamin C, and glutathione, and you're going to help people.
Yeah, definitely. I mean, those are kind of the basics there. All right. So the foundations of health, they're becoming a part of the foundations of health.
Yep.
Okay. All right. So these are some questions. I'm going to get into the rapid fire questions. These are some questions that I ask every single one of my guests. So I want to know, what does Mahan Health mean to you?
Mahan Health, or great health, not only being the brainchild of you, my friend, but also I think great health is something that we all strive for, and something that we shouldn't think is unattainable. It's something that we should raise our expectations to expect great health, and to expect our providers to help us along the path towards great health. And also, I like that it's kind of simple. It's just great health, and the KISS principle: keep it simple, stupid. That's what we all want. We just want to feel good. We want to be in great health, and at the end of the day, if that's what our goal is, then you're doing a good job.
Right. I really like that. I really like that we should just expect to be able to obtain great health, and expect our providers to help us obtain great health. I like that. All right. So what was the most difficult health change for you to make? So the next 2 questions might go hand in hand. So what was the most difficult health change for you to make? And then what are you still working on?
They do go hand in hand, for sure.
Yeah.
I think it's something a lot of people can relate to, a work-life balance, responsibility, life balance. Just trying to always make sure that we're taking care of ourselves. There's things that are unavoidable. We always talk about stress management here. And, that's something that is usually easier said than done. But I am always trying to work on being an example for my patients, so that we can see what work does for you.
Mm-hmm. Can you give us a specific example of like a work-life balance thing that you're working on?
Sure. Maybe little routines can be really helpful just to start out with, like getting a healthy habit, healthy exercise routine, yoga, meditation, just implementing some of these nice activities that kind of help your body physically and also can help clear your mind at the same time. These are some practices.
And what are you doing specifically? Have you
Well,
started
I'm
some
working
yoga?
on that, and trying to get my warrior pose down. Yeah.
Okay. All right. The last question that I have for you is, if you could have any commercial on health, what would it be about and why? This is more of like a PSA, right? We're not really necessarily trying to sell anything, but a PSA commercial, what would it be on and why?
My PSA. My PSA. That's funny because we do actually have a slide, and I kind of already said this. We have a slide in a lot of our talks that we tell people, and it says just raise your expectations. And I think I might just repeat that. We should all strive for more all the time.
Yes, and that goes right with what you were talking about with Mahan Health. Raise our expectations. Love it. All right, so where can people find you if they're looking for you?
Okay, so I am the founder of Biomed Health Center out here in San Diego, California. You can look us up online, biomedhealthcenter.com. Instagram handle, biomed_health. You can find us on Facebook. We're always posting about things we're doing locally here. And we post little tidbits of information all the time. If you're not close, hopefully you can learn something from our social media stuff.
Yeah. I think you have a post on ozone too when you were receiving the treatment, or?
Yeah, we have lots of ozone stuff.
Yeah.
Love ozone. There will be no shortage of ozone content.
Yeah, exactly. Yeah. Yeah. So you can even see what it would look like before you even get it done. Right. I mean, that's the great beauty of social media.
Absolutely.
All right. Well, Dr. Ng, it was so great having you on the show. Thank you so much for coming.
Thank you so much for having me.
Of course. Bye.
Well, I hope you all enjoyed that episode. I will have Dr. Ng's information in the show notes below, so make sure to check that out. Like I said, he's given a lot of great resources, and make sure to check out the video version to see those before and after effects. I do want to say that steroid shots are increasingly common amongst people dealing with pain, and ozone therapy is a great way to get to the root of the issue. So if you're someone who fits into any of the categories Dr. Ng and I discussed, make sure to explore your options and consider ozone therapy as a treatment option as well. All right, that's all I got for you all today. Wishing you all Mahan or great health, and I will see you next time.